Welcome to today's Health Matters with me, Dishen Kumar. We are in Gleneagles, Kuala Lumpur. Now we are here to talk to the consultant pediatrician about congenital heart defects. Now, what is congenital heart defects? We'll have that all in today's episode, and also it doesn't only affect newborn babies but also adults as well. Join me in today's episode. Alright, thank you doctor for having us today.
Thank you.
You're a very busy person, so we'll get right to it. Now, when we talk about congenital heart defects, or congenital heart disease, what are we talking about actually?
Congenital means that you're born with it.
Okay.
That's the first definition. Heart defect means that you're born with a heart defect. So you trace it all the way back to pregnancy.
Okay.
So these defects are, unlike other diseases, they are present even in the mother's womb as the heart is being formed. As the heart starts to beat, then things are started to have gone wrong actually. So when you're born, by the time you're born, all these children who have congenital heart defect, they are already born with a problem.
Okay. And when you said when the child is in the mother's womb,
Yep.
When is it exactly? Which week is it?
Usually just even a few weeks of life, a few weeks of the formation as the heart started to pump, okay? Already, the defects have already been formed already. The heart, when they are formed, is like a tube, and then they fold, and then they grow septum to close and to separate the chambers into the upper chamber, the lower chamber. That is the time that this thing is being formed. So as the heart is formed, if the septum or the wall are not formed well, then you're left with a hole in the heart. If the blood, and we also have wall that separate out the tube into vessels. So vessels that goes to the lung, vessels that goes to the body, and if this septation is not correct, then you will end up with, for example, blood vessel going to the lung, ended up in blood vessel going to the body. So the switching of the blood vessel, vessels can be blocked as well. It can be absent completely. So chamber of the heart can be underdeveloped. So all these are things that can happen actually. Yeah.
Oh, why does this actually happen? Is there a specific reason to why this?
Okay, we believe that it is. We have evidence that shows that it is interactions between the genes, okay, and also the environment. Okay, but we cannot, in general, pinpoint what is in the environment. There are certain things in the environment that can predispose a pregnancy to congenital heart disease. For example, mothers who were infected with viruses like rubella viruses, for example, then these children, when they are born, they have increased incidence of cardiac defects. Certain maternal medications that mothers take can also predispose a mother to that. But many children who are born with congenital heart diseases, their parents themselves may have congenital heart disease as well.
Hereditary in that
Yes,
sense.
in hereditary. We have cardiac surgeries available. So for many years in this country already, we have seen children who had congenital cardiac lesions has grown up, and then they are coming to us now. Some of them come with their wife who in a pregnancy, and the baby in the womb has congenital heart disease actually. So there is an element of hereditary elements.
You need, okay, and also the environment as well.
Yeah.
Like what supplements the mother is taking, medication or is
certain
it
types
food?
of medications.
Certain
medications moms are taking, for example. Yeah,
so if people want to know about this, what can they do? Should they consult their physician if they want to know? Should mothers who are pregnant, if they want to not have this and want to avoid all that, what should they do?
Well, sometimes it's unavoidable actually. The best thing to do is actually a screening. The best screening that's available is what we call antenatal. Antenatal meaning that before birth. Antenatal, before birth ultrasound. So who does the ultrasound? Usually obstetricians who are skilled in looking at the baby. Most obstetricians will actually do a scan when the baby was in the mother womb.
Okay.
So there is something called a congenital anomaly scan, and that is usually conducted when the baby was around 4 months plus.
4 months.
4 months, okay, in the mother's womb. So there will be a time around 18 weeks of pregnancy, and these are the job of obstetricians. So trained, skilled obstetrician, we call them maternal fetal specialists, can actually run through the whole baby from the head all the way to the toe, okay, and they can actually detect that, and the congenital anomaly is part and parcel of this congenital anomaly scan detection. So meaning that we actually rely on skilled obstetricians to detect that. Okay, yeah.
Okay, and detection in that sense, obstetricians, when they look at the baby, can they immediately know, or is there something else they see there's something wrong, and that we need to do more tests?
As we were talking about detections antenatally, let's talk about the ideal, and let's talk about the reality.
Okay.
Ideal is actually that every single congenital heart will be detected by the obstetric screening, but the reality is no. Okay, no, because of two things. Number one, that certain cardiac conditions are very difficult to detect in utero, meaning inside the mother's womb. I'll give you an example. We have a heart which has 4 rooms in the heart. You have a wall at the top, at the wall at the bottom. So all baby, when they are in the mother's womb, they have a hole. We call it interatrial communication. That one must be present in the mother's womb, in the baby's heart. And that, if the baby does have a hole like that, then you cannot say that the child has a congenital heart problem. But if that hole does not close, then it becomes a congenital heart problem. So such patients cannot be detected and determined to have congenital heart problem in utero. Hole at the bottom, called the ventricular septal defect, for example, if they are very big, they can be detected. But however, some of the hole called ventricular septal defects are very small, so it is beyond the capability of the present technology to detect it. But that is not important. What is important is actually serious congenital cardiac lesion. For example, people who has a very small chamber and a very big chamber. So we call it essentially a functioning single chamber. Those can actually be detected. Blood vessels that get out of the heart, there are 2. One goes to the body, one goes to the lung. Sometimes one of them can be absent. That also can be detected. That is ideal situations, okay? However, that even in the most advanced country, such ideal does not sometimes happen, because that to train big army of obstetricians who are able to do all these things, you need to put in lots and lots of resources. Even in the very developed countries like in Europe or North America, they have not even reached the ideal. So many congenital cardiac problems are missed. They are missed in utero and they are born. So when they are born, then your next question will probably that, can we then detect them early? Okay. Yeah, we do have signs and symptoms to detect them. But nowadays, as in many hospitals in this country, we have already started embarking on the detection drive that is actually called pulse oximetry in the foot. Okay, you will probably ask, why in the foot, and what is pulse oximetry? Pulse oximetry means checking the oxygen level of a newborn baby after the baby has stabilized, and checking on the foot. Okay, that will not detect every single congenital cardiac lesion, but detect a big group of congenital cardiac lesion that can be life-threatening. So by listening to the child, you may not be able to pick it up. By looking at the child, you may not be able to pick it up. So that pulse oximetry, when they are below a certain level, then it ring a bell, say that look, something might be wrong in the heart, and that is actually helping us to detect a big chunks of congenital cardiac abnormality, knows about it before babies are being sent back in the private hospital, in the government hospital. Many have already started doing that, and I'm sure that over the next couple of years, this is going to be widespread and is going to be part and parcel of a normal newborn screening.
because congenital heart disease defects doesn't only affect, it affects when the child is born, but sometimes it doesn't get detected until the child is much older. Have you had any issues when the child is like much older, not when it's in infancy? And does that create even more complications?
Oh yes, certainly. As okay, there are this thing happened. That is partly is the way the child is being brought up, and partly is because of the resources of the country, and partly also because maybe the medical attendants not be able to detect it. There are multi reasons for that, but we have actually one of the common conditions that often that are being missed in childhood and detected only in adulthood is atrial septal defect, meaning that the hole between the two upper chamber of the heart. Atrial septal defects is one of the common hole in the heart, and we have seen people who are in their teens, in their adulthood, in the middle life, or even in their old age, they're coming with huge hole in the heart, and they have been well, they have been apparently well without realizing that they has actually serious congenital heart disease. As you say that what impact they have on this, of course, it shorten their lifespan, it reduce their quality of life. Like people who have large hole in the heart, atrial septal defect, if they are detected in late adulthood, the lungs will probably be damaged. The heart is so dilated, they kind of predispose them to abnormal heartbeat. So that would be the one of the examples.
So it's so interesting, because when you sit down and you research about congenital heart disease, you realize it doesn't only happen to infants. People go throughout their whole lives without knowing there's something wrong with them.
Some of them, yes, but increasingly rare now.
Yeah.
Because as I told you that obstetrician detect them, pediatrician look out for them, and even though they miss out with those pulse oximetry, people listen to their heart. They're increasingly getting rarer and rarer, especially in this country.
How do you say, how can you say about the treatment part? Do all congenital heart defect patients, do they all have, after they go through treatment, do they all have a proper life, or they still can't enjoy a normal life as such, and things like that?
Well, treatments are divided into category depending on the nature of the lesions. So we have curative treatment. Giving you an example, that if you have an extra blood vessels in the heart, we call it a patent ductus arteriosus, or PDA in short. You ligate, you tie it off, or you use a device putting into the heart without surgery, you block it off, you cure the child. So that is curative.
So not all treatments are surgery?
No, not all are surgery. You have a hole in the heart, a ventricular septal defect. You have a hole in the heart up there called the atrial septal defect. You can either put a device in and close it, or you can have surgery to close it depending on the need. We won't go into those details, but those conditions, once you close the hole, and if you do it at the appropriate time, not at, like, for example, in adulthood, then you cure the person actually. So those are curative operation. But there are those who actually are corrective operation. You correct those but then sometimes you leave behind something. Inevitably. I'll give you an example. There's a very common condition. We call it tetralogy of Fallot. Tetralogy of Fallot means that conditions of the heart, they have four things. Tetra meaning that they have a hole in the heart. Secondly, they have a blocked vessel to the lung. And third thing is that the blood vessel that's coming out of the heart going to the body, we call it aorta, is supposed to be entirely coming out from the left side, but it rides in the center. Partly from the right, partly from the left. That is the third thing. And the fourth thing is that as a result of the blockage of flow to the lung, the right side of the chamber called the right ventricle is hypertrophy, very thick. So that actually
one problem,
yes, four problems.
Wow.
So we can correct it. We can close the hole, we can make it big, the blood flow to the lung can make it big. But some people, they are born with very small blood vessel to the lung in tetralogy. So during the surgery, inevitably the surgeon has to cross over the door, and in the process that the valve is destroyed in order to create a patent and unobstructed flow. So these people will have something left behind, a leaking door. And this leaking door, after 10, 15 years, or sometime earlier, sometime much later, the leaking of the door can create a situation where the right side of the heart become more and more dilated. And when that happens, then you need to have surgery again in order to correct that. So that is corrective. But there are also conditions who are palliative. Palliative meaning that you cannot completely correct the whole thing, especially a situation where there's only one single chamber of the heart. So you go through a series of operations, and this series of operations will tend to prolong the life and improve the quality of life. But nature is such that God has made the heart in a certain way to last a certain period of time, but human trying very hard to prolong that and to make use of whatever abnormality there to sustain a long duration of life, then it is not perfect. So these conditions are not corrected, even they are just palliated to prolong life, to improve the quality of life. That's all. Yeah.
Okay, and we have to talk about the Gleneagles, what Gleneagles is doing, a Heart for Heart event.
Oh yeah.
Can you explain a bit more about that?
Well, the Heart for Heart event is actually that we concentrate on helping children with congenital heart problems, okay? And we concentrate on helping local children. So your question is, why should we, a private hospital, doing this kind of charity program? There are a few reasons for doing so. Number one is that the hospital administrations and the doctors has a passion on congenital heart, because we think that is a program that is actually worth pursuing because it does have long-term impact. Can you imagine that slowly, day by day, one by one, many of these people who had these defects corrected, they are actually active contributor to societies. That's the first thing. Give you an example. We had an event just now. Sitting in front were a group of Rotarians, and among them, one of them has congenital heart problems. Okay, for confidentiality, I wouldn't mention who it is, but you can see his life. Okay, his life is that as he said, that without a charity program for him many years ago, that he wouldn't have survived. Okay, it was a charity program, not by Gleneagles, by some other local newspaper. At that point in time, Malaysia do not have any congenital heart programs, and he has to fly overseas for the surgery. But it is because of a charity program, his life was saved. He is now a father, and he is now a successful individual, and he is somebody who ploughed back into societies and from the charity works he does, and he does this kind of give back to the society for many years, helping people who have congenital heart to go through surgery. So that is what we want to do. That's first. And second thing is need. The need. So why need? You say that now isn't the country has enough resources to operate in the government hospital, in the semi-government hospital like the National Heart Institute. What should Gleneagles' role be? It's never enough. Okay, we are unfortunately still a developing country with a high birth rate, even in a very developed country like in Australia, for example, and also in Americas or in Europe, for example. Even that there is a waiting list, a pretty long waiting list sometimes. So not to say in Malaysia, okay. And our because of that, I think that is where the private sector is coming in to help. Okay, it is not money and cents earning money alone. I think each and every doctors, I think, in my opinion, can do whatever they feel like they are doing, and we opt to contribute back to society in this way, in the sense that to do a big chunk of our work doing this kind of heart for heart program.
Okay, and maybe final question for you, Doctor.
Yeah.
What advice do you have for parents who have or who think their child has something wrong, or for parents who are going through this situation where their son or daughter, the children has this disease, what advice do you have for them?
Advice for them? I think that, one is seek treatment, that's all, because in this country, treatment is easily available, particularly in terms of diagnosis, planning for treatment, okay? But there is always in congenital heart disease a critical time to do the best thing for the best results. So don't delay. Always remember that the government hospital, and we have also the private sectors, and then if they cannot truly afford, don't despair, because this is a country with a big loving population, and I believe that I've been working with people who are very compassionate on people with congenital heart disease. They've been helping us for the last 20 over years in Gleneagles to do that. It's just a matter of organizing ourselves, as I was saying, that organizing ourselves so that we can collaborate with people who want to help these people, and just don't shun away and don't run away, that's all.
All right. Thank you so much, Doctor.
Yep, okay, right. Thank you.
Now, thank you. This has been Health Matters with me, Dishen Kumar. Today's topic, congenital heart defects, and we talked to our consultant pediatrician, Dr. Lim, about everything that we need to cover about the topic. But the most important thing, the conclusion of this episode, is that if you think that your child has this disease, please consult your doctor immediately. We do not know what they may find. Please like and share all our videos on all our social media platforms. My name is Dishen Kumar. I'll see you in the next episode. Goodbye.